So my name is Dr. Stephen Beyea. I'm the lead scientist here at the Biomedical Translational Imaging Center, and I am a researcher in medical imaging technology. So BIOTIC, which is the Biomedical Translational Imaging Center, is a research center that is located both in the QE2 and the IWK health centers. We are an imaging research facility. We both develop new imaging technologies as well as seek to translate those technologies into the clinic with people both in industry and within the clinic itself. So with the work that we're doing here in BIOTIC, very specifically what we're trying to do is not just create new research, not just publish more papers, all of which is vitally important, but we seek to do work where we can find clinical partners to translate it into the healthcare setting and find those industry partners that can allow us to take this research, turn it into something that can be sold as a product around the world. And in doing so then, we benefit not only Nova Scotia's patients here today, but the potential for both healthcare and an economic benefit to this province in the long term. So we've received funding from NSHRF across a spectrum of different programs, some of which were research grants funding my own research, as well as research grants such as the Establishment Grant Program, which have been critical for some of the new researchers that we have brought here to BIOTIC and to Nova Scotia. This has then been key in both allowing us to move specific research projects forward, as well as to attract new researchers from places like Stanford and so on, that we could bring them here, allow them access to funds that would get their programs off the ground. And I've been honored to both receive grants on other people's grants, allowing us to increase our research capacity here in the province. An example of how NSHRF funding has allowed us to strategically grow our programs would, for example, be our partnership with GE Healthcare. We now have a 5-year program of research that we're doing in partnership with GE Healthcare that is now a very large program of research in which we needed some specific expertise in terms of research coordination in order for us to pull that off. NSHRF funding allowed us to get that research coordinator at the time that we needed, get that person on the ground, and allow us to move that research forward. And in doing so, that in many ways enabled our entire 5-year research program with GE Healthcare. So probably the biggest example of how NSHRF's support has helped us really was when BIOTIC as a research center came to be. So initially we were part of the National Research Council, and when the NRC made the decision to withdraw funding from medical imaging and we decided to transition into becoming a part of the health center, we needed funders to step forward and help us make that happen. And it really took somebody to step forward the first and say, we're in, and all the rest of the funding flowed from there. And NSHRF was that first one in. And so they were absolutely critical, and I can say that without NSHRF having stepped forward and provided that first bit of funding, our research center would not exist today.